Hi everybody, this is our second video about herpes. Let's take a look at more questions we got about herpes.
Hello, I'm LaShawn. I always wanted to know, how do you know if you have herpes?
So how do you know if you have herpes? The symptoms for herpes can vary from person to person. Sometimes you can have no symptoms at all, but most times, especially for genital herpes, you'll have sores or blisters on your private parts. You might also notice that you have swollen glands down where your hips are. For herpes 1, it's simply a sore on the lip. Also, you might have a discharge with herpes, but not everyone has this symptom. Learning you have herpes really involves just getting a blood test. But if you have a sore on your genitals or your private parts, your doctor can do a test and send it to the lab to see if you have herpes.
What are people's sex lives like after being diagnosed with herpes?
If you have herpes, you can still have a normal sex life. It's really important to talk with your partner about having herpes because there's treatment for herpes. You can also control whether or not herpes is transmitted to your partner. And because many people have herpes and don't know it, this is all the more reason for us to talk about herpes so that it's not as stigmatized.
What part I'm from is most like women, they have it and they pass it along and you get called you dirty and all that stuff with it.
There's a myth that women are more likely to have herpes, and that's not true. Many people have herpes and don't know it. So regardless of your gender, you can get herpes through oral sex with someone who has a herpes lesion on their lip or by having sexual activity with someone who has herpes. Also, he notes people with herpes are dirty. And this is not true. We have to talk about herpes and ensure people know anyone who's sexually active can have herpes. But because often the symptoms are invisible, people don't know they have herpes. So they can still transmit herpes and not know it.
Does it pass on to your children? Is it genetic?
Herpes is not genetic, but pregnant people can pass herpes to their babies, which is why it's important for anyone who's pregnant to see their healthcare provider and get tested for herpes.
Can you treat herpes? And is there a cure for it?
Both herpes 1 and herpes 2 are treatable with medication. So if you think you have herpes, although it's not curable, there is treatment. Contact your doctor and get treatment for herpes. If you have more questions about herpes or any other sexually transmitted infection, just send us a message or leave a comment below. And don't forget, hit the subscribe button.